Hi, everybody, and welcome to the first episode of Titans Lead. I'm Dan Luisi, the Director of Alumni here at Holy Trinity High School. I'll be moderating the Titans Lead events, and the idea behind the Titans Lead was to create a mini-series, a monthly mini-series, that would give our students the opportunity to connect with alumni, not only local, but also all across the country. So we have some exceptional alumni from the medical field joining us today. And this episode will shed light a little bit on frontline workers and how the pandemic has impacted them at their jobs. So before I introduce our alumni, I want to introduce two seniors that are going to be here assisting me moderating. To my left is Bryce Ridley, senior, track and field star, Corps ambassador. And to my right is Neela Kalaprasad. Neela is a part of the dance company. She's also a figure skater. And like I said, one great student. Both of these students are ranked at the top of the class, and they both aspire to work in the medical field. So as we begin now, I just want to introduce our panelists briefly and give them the opportunity to speak a little bit about themselves. So first is Dr. Joseph Pilate, class of 1977, president of the liver disease specialist at Houston Methodist Hospital, radio host and author, checking in with us from Houston, Texas. Welcome, Dr. Pilate.
Great to see you. Thanks, Dan, for organizing this.
It's my pleasure. I really appreciate you guys jumping on. So is there anything kind of you can speak a little bit about, maybe your college background and how you ended up in the role you're in today?
Sure. So after wonderful 4 years at Holy Trinity, graduated in 1977, went to Syracuse University following that. Took a couple of years off, worked in New York City at CBS headquarters, working in their medical department, and then went to medical school, did my residency back in Brooklyn at Kings County, SUNY Downstate, in internal medicine. And then following that, I went to University of Nebraska in Omaha to do my gastroenterology training and liver transplant training there. And then much to my surprise, I was recruited by University of Texas in Houston at the medical school there in the Texas Medical Center, right over my shoulder there, to head up the new liver transplant program that was starting. And that was 27 years ago. And I've had the opportunity to work at and start different transplant programs at all of the Houston facilities here. So it's really been a great journey over the past 27 years. And as I tell so many people, the relationships, what I learned in high school at Holy Trinity, really to this day, truly stay with me. So don't neglect the relationships that you're making right now.
Thank you. That's amazing. By the way, just looking at your picture back there, it's make me wish we had some warmer weather over here.
Well, I won't tell anybody. I don't know what the weather in New York is, but it's short sleeve and shorts, so we're good.
All right, thank you for that. So next, Dr. Margaret McGovern, class of 1974, physician-in-chief at Stony Brook Children's Hospital, dean for clinical affairs, and vice president of clinical programs at Stony Brook University. Thank you for joining us, Dr. McGovern.
Thanks for inviting me. So obviously I'm a Holy Trinity alum, then went and did my undergraduate education at Stony Brook University. And from there went to Mount Sinai School of Medicine in New York, where I did an MD PhD program, my PhD being in genetics, followed by training in pediatrics and then in clinical and molecular genetics. I stayed at Mount Sinai for many years, working in clinical research, and I was the program director of their General Clinical Research Center, conducted funded research in rare diseases, and left there in 2007 to go to Stony Brook as the chair of pediatrics, and grew that program and led initiative to build a children's hospital at Stony Brook, which opened in 2019. And 2 years ago took a little bit different roles as Dean for Clinical Affairs in the School of Medicine and Vice President for Health System Clinical Programs and Strategy, which is what I've been working on most recently. I would agree with Joe that, you know, the relationships you develop at Trinity are, so hopefully you'll be fortunate. They'll be some of the most valued ones you'll take with you through your life. I'm still very good friends with lots of my fellow Titans that I graduated with. And, you know, that's a great network to add to your networks that you build as you go on in your education.
Thank you very much. Yeah, you know, just specifically speaking, again, like I said, I can't thank you all enough for doing this. I'm very actually close with your family, with Mr. Jacobina and the Jacobina. I went to school with Brian. He's a good friend of mine, and your family is a great family, and they're Titans all the way.
They are indeed. So that Brian and Joe are my nephews.
Yep.
Their dad's my brother. Yeah.
Lastly, Dr. Kwame Inan, class of 1999, orthopedic surgeon. Kwame is checking in from Plano, Texas, which is just north of Dallas. Welcome, Kwame.
Thank you so much. So I graduated from Trinity in '99, and I took with me a lot of lessons and determination and you know, ideas about how to be successful. Took that to Stony Brook University. Dr. McGovern did my undergraduate studies there in biochemistry and religious studies. I then went on to medical school in Cincinnati, and I went to UT Southwestern to do my orthopedic residency. And then I did a fellowship in total joint reconstruction. Have a busy practice in Plano. Still do a lot of clinical translational research and publish quite a bit, even though I'm not in an academic setting. But ultimately, I'd say that, you know, Trinity taught me how to challenge myself. Trinity taught me how to make relationships with other people who are also challenging themselves and to strive for greatness. So thank you for having me.
Of course, thank you so much. So we're going to get started now. I know we're all, you know, crunched on time. So we're going to start with the questions that we have created, and they kind of have a blend of, you know, your story and how you got in the position that you are today, but also a little bit of current times and how maybe the pandemic has been impacting you in your workplace. So the first question will be asked by Neela.
How has your education prepared you to have success in your career? Dr. McGovern, if you'd like to answer first.
I didn't hear the last part.
Okay. Just a little, it's okay.
How has your education prepared you to have success in your career? If Dr. McGovern, if you'd like to answer first.
Well, you know, the education path is obviously essential if you're entering a health career, right, as a healthcare professional. So, and there's many different dimensions to that education. So, you know, the undergraduate degree sort of being the platform from which, you know, you spring into your medical training. You know, I happen to do an MD PhD program. So I was doing my clinical training interspersed with laboratory research. And that combination of training, I think, well prepared me for thinking about novel ways that we can approach complex medical problems, you know, thinking about how do we take care of a patient clinically, but, you know, what can we do to make their life better by developing new therapies, new treatments, you know, taking ideas from the laboratory into the clinic. And that's very exciting work. You know, doing research, any research, and in medicine too, this is true, you know, is creating new knowledge. And that is a very exciting endeavor to be involved in, to create new knowledge that, you know, that you bring forward to the world in your publications and the work you do. So all of that really, I think, prepared me very well for, you know, most of the dimensions of my professional career. Now, what they don't teach you and prepare you well for, which I now spend a lot of my time doing, because now I have large administrative and financial oversight roles. Medical training doesn't prepare you well for that, and that's like on the job training. So, you know, when I became chair of a large clinical department, I had to learn all of the nuances of, managed care contracts and the payment models and the best ways to, keep the department financially solvent. And now that I'm doing that on a bigger level for the health system, and, I'd say I got an on-the-job training MBA because I never went and got a formal MBA, but I think I could go head to head with any card-carrying MBA out there with my finance skills that I acquired literally on the job in real time, solving real problems. Because like any other endeavor, if you don't have the financial resources, you can't move your program forward. So it's an important thing for physicians, and I'm sure my physician colleagues on this program, have faced similar things that, and they don't teach you that in medical school. They don't talk to you about that piece.
Yep, the learning never stops, right? And a lot
That's
of it.
correct.
All right, Dr. Inan.
So I say that the part of my education that prepared me for success that no one really talked about, I'd say, was how much the people that you meet along your journey affect who you ultimately become. And so I'd say that, at this stage of my life, that who I am in a professional sense is an amalgamation of great qualities that I, observed along my path. And so, I can tell you that there were teachers that I had at Stony Brook. I can remember one specifically, Sister John Rose, and she probably has no idea that she had this kind of an effect on me, but she was very meticulous, detail-oriented, and did not accept mediocrity. And so, when I was in my class, I don't know that she would have described me with those characteristics, but I definitely took that away with me. But I could tell you that I had an attending in residency that was just the meanest guy in the whole world. But you just took a step back and just watched him do his thing, what you realize is that he cared so much. And because of that, he always prepared, and he always was very diligent. And so, if you take that kind of an approach to everything that you do, always making sure that you're prepared, always making sure that you're on time, and God blessed you with a brain that works, you can do lots of great things. So.
Thank you. Dr. Galati?
Well, I'll tell you, this is a hard act to follow with, two very wise sets of comments here. I would say what I would add to exactly what they were saying, I would say your education, you have to develop discipline to study, discipline to stay focused, discipline to dig and ask questions. And I would say if you try to go through a medical career, scientific research, be it clinical or basic science, in a superficial way, I don't think you'll get very far. You may be able to squeak by, but to really say that you committed yourself to something to be successful, you need that discipline to really, really stick with it. And I think a lot of young students, and these may be students that are finishing college or grad school or even medical school, there is a certain underestimation to the amount of time and commitment that it takes to get from point A to point B. So that really would be one thing. The other word I like to use a lot is, as you are learning and going through all the various educational facets of your life, it is to have deep domain knowledge. And I sort of ripped that off from a book by the name of Linchpin by Seth Godin. And he talks about deep domain knowledge, where you have to have a wide spectrum of different topics. It may be completely out of your field of interest, but you have a deep domain understanding of that area, which is going to make you absolutely invaluable to your organization. So even if you're going into the medical sciences and biology and chemistry and physics, but you're the person that is sort of that computer whiz that knows how to unlock everybody's password, you become very valuable. If you know how to have another skill, you become very valuable. So step outside of your comfort zone and really, really learn as much as you can on unrelated topics. It really is key.
Great. Thank you for all your answers. So next we have Bryce, who's got a question for you guys.
Moving on to working through the pandemic, what was the moment that has had the most impact on you throughout COVID-19 at your job? Dr. Bellotti, if you'd like to answer.
Well, I saw this question, and all of it has been so impactful, dealing with very, very sick patients with liver disease waiting for liver transplants. I think the most impact was when my first patient with COVID died. It brought on a certain reality, and we had at first sort of been lucky where we had patients that were being treated as an outpatient, but there was this one particular gentleman that had been waiting for a liver transplant for probably a year and a half, and out of the blue came into the hospital with a little head cold, and we found out he had COVID a couple of days later, and he passed away within 3 or 4 days. And it was very, very sobering that this is nothing to play around with, and that this really is going to take a lot of people's lives. And we felt very, very naked out there. We really did not know what to do. Now, very fortunate. We're all at, large metropolitan areas and large research facilities that we were able to get involved in a lot of the technology that a lot of other centers around the world are using. But in those first early days, we were just riding by the seat of our pants. And that was really the most sobering moment when we lost our first patient.
I'm so sorry to hear that. I'm sure you've all experienced loss to some extent. And Joe, you know my story about my father as he was going
Yes.
through, and we were fortunate enough that he got a kidney transplant that he so desperately needed. But there was a long delay in this process because, the pandemic kind of shut all of those transplant surgeries down. So, it's been something that's been really tough for everybody, but, you just got to keep fighting and getting through it. So, Dr. McGovern, would you like to follow up?
So, I guess my moment came even earlier than the first patient death in our hospital. And that was one afternoon when a patient was admitted, diagnosed with COVID. This was when I think the whole country, and certainly us here in New York, was still in like deep denial and thinking somehow COVID was going to pass us by. Even though, the terrible stories, obviously first coming out of China and then Italy, about this terrible infection, how contagious it is, and how difficult it is to manage medically. And the patient had got admitted who clearly did not have any high-risk travel. And then our epidemiology person in the hospital started to speak to the context of that patient, the family, where he'd been, et cetera, and sort of did the drill down. And just, I saw her face drop on the phone when she was talking to the people and getting all the history. And she just looked up and she said, "This is community spread. This is not, a patient who got off a plane last night in JFK with COVID. This is in our community, and this is going to come like a freight train." And it did. And, we went from that one patient on a Tuesday afternoon to, the next, just a week later, having hundreds of infected patients in our hospital. So that was like just a total wake-up call that, this is coming. And all the terrible stories that, we were hearing from colleagues in Italy and in Europe about, the large, difficult decisions they had to make about managing these patients and handling this onslaught of very sick patients, really just hit everyone in the face that it's here. And now we've got to get ourselves together, to meet this crisis. And, and we had it before you guys in Texas, right? So we were in the throes of this before it spread across the country. And, it was a very, very difficult time. I really hope that maybe some of the lessons we learned in New York trickled their way down south and helped you all in managing these patients, because, how we manage a COVID patient today is completely different than what we did last February and March, right? So we learned, just the learning curve here has been just breathtaking, and how quickly I think, the medical community has adapted and integrated that new knowledge into their practice of taking care of these patients. That's like, it's actually one of the most exciting things of being in medicine. It's not so pleasant or exciting to be, facing this enormous public health challenge, but I think, how the medical community has come together, responded to this, shared information and best practice, is literally saving so many lives in this, this current surge that we're seeing.
Thank you so much. Dr. Inan?
So my most impactful moment had to do with one of my roles as being the chairman of surgical services in the hospital where I work primarily. And that facility is one of the busier facilities in the Metroplex. And early on, when and after COVID had been ravaging New York, after it started making a big impact in Texas, we also were dealing with some of the political issues and the logistical issues as far as personal protective equipment and things like that. And so as a busy surgeon who is at the head of the surgical services department, making decisions about, are we operating, who can operate, and where are we shuttling personal protective equipment, early on in the pandemic, where a lot of people did not believe that it was going to be such a big deal, having to convince people or mandate that they couldn't do, their livelihood in the hospital was kind of a scary and hairy kind of thing. And so, because the best science that I read and all the data, especially coming out of places like New York and Connecticut, were that this was real, that this was spreading in a geometric way, and was going to overrun our hospital system, we had to make decisions to shut down elective surgery so that we could shuttle personal protective equipment to where it was really needed, while at the same time waiting and communicating back with the suppliers to get appropriate numbers of personal protective equipment to the frontline workers who really needed it the most, and then to allow us to kind of backfill and to do operations if it was possible. And so just kind of navigating that piece logistically, politically, was very, very challenging, and really opened my eyes a lot to how things happen on a large scale in the medical profession, as well as dealing with patients directly.
Thank you. So next question is going to be asked by Neela.
Tell us about a moment during the pandemic that you felt proud. Dr. Inan, if you'd like to start.
I was unable to hear your question.
Yeah. A moment during the pandemic that you felt proud.
So although primarily I do elective total joint replacement, I also do orthopedic trauma. And during the pandemic, early on, I had to deal with a bunch of patients who were involved in a car accident. And many of those patients had COVID-19. And, during that process, trying to appropriately shuttle employees and staff and try to minimize patients with COVID-19 being in close quarters with employees, I was doing complex femur fracture repairs with minimal staff and tons of protective equipment and getting good outcomes. And so in the process, it just kind of streamlined our processes to ensure that our staff was not exposed to, the virus early on, especially with the number of unknowns that were out there. And so I was really proud of being able to kind of streamline those processes across the hospital.
Dr. McGovern?
So as Kwame is alluding to, and you probably shouldn't be surprised to learn, hospitals are big, lumbering bureaucracies that I would not say they're known for their nimbleness, right? But something I can say I'm really proud of is how nimble the hospital has been and the hospital staff have been during this pandemic. So things that normally you would study and deliberate about and discuss for months or even years literally happened in days. So in a 1 week period, Stony Brook University Hospital opened an incremental 455 ICU and ICU step-down beds. That's like mind-blowing. That's more ICU and ICU step-down beds than we have in normally. Opened those beds, equipped them, staffed them, You know, everyone was completely flexible about being redeployed, reassigned. Like you in Texas, you know, we had to shut down elective surgeries, and that's a huge financial hit for the hospital, but it had to be done because we needed those staff to staff these ICU beds. You know, we're a part of a university, and, you know, our engineers were figuring out ways for us to leverage our ventilator assets. So we were ventilating 2 patients off of 1 device, and they created devices to do that. Just lots of clever, great ideas. Actually was one of the guy who runs our surgical intensive care unit very early on said, you know, the therapy here is oxygen. And like, could this hospital run out of oxygen? Do we have enough oxygen capacity to take care of all these patients? And in 2 weeks, we built an oxygen farm outside of our hospital, laid a cement slab, secured oxygen supply. We have these huge oxygen tanks now. And there were hospitals in New York City that ran out of oxygen because that was the mainstay of the therapy in the spring. And, you know, just that people were clever and thinking, and that the hospital administration and the operational people could respond to all of that so quickly and get it done. It really did make me proud because, you know, this was literally, it's not hyperbole. I mean, this was saving lives. And, you know, then those actions we took helped to save lives.
Dr. Galati?
Well, again, you know, great answers and great lessons for everybody to learn from. And you know, sort of a similar story. So here we are in the spring, and transplant programs around the country were basically shutting down. And when a transplant program shuts down, you've got these very sick patients, especially the liver patients, because nothing against, you know, your dad in any way, but patients waiting for a kidney transplant have that backup of dialysis as a temporary fix. But with liver disease, it's, you know, there's no support that we have for them other than transplant. And after about 3 weeks, we realized that the patients that were waiting were getting very sick and dying because we, as the entire country, had a self-imposed moratorium on transplant. And we organized a meeting to say, look, we have to do something. We have to forge ahead. Now, the hospital was allowing us. We were not on an elective surgery category. Transplants were considered vital. And so actually, in the majority of 2020, we did more transplants than we had ever done before in a year because other programs that were not opening, that were not being, in a sense, bold enough to try to do the transplant, these organs that were being recovered were not being used. We were accepting them. So we were getting organs from around the country and able to implant them in our patients. And so it was bold. We've done very well, but we looked at it that we've saved many, many lives that may not have had the opportunity to get transplanted. So an unintended consequence of a bad situation, really, to look at it that way.
Yeah. Well, I mean, thank you so much for sharing kind of all your stories about, you know, the pandemic. And I know it's going to be a tough conversation, but just hearing your insight about being on the ground floor for all this, you know, we're so grateful and so proud to have people like you guys, knowing that you're caring for friends, family, classmates, neighbors, you name it. So thank you again. Next, Bryce, you have a question?
How have you managed self-care during this crisis, especially if you have been isolated away from your family? Dr. McGovern, if you'd like to go.
So probably not as well as I should have. Self-care. Yeah. All right. I did one crazy thing. I bought a puppy. All right. So that was probably one of the world's worst decisions in the middle of the pandemic. So I'm training a dog. You know, I think everyone's been isolated, you know, from their wider circle of friends and family. And that applies obviously to all of us as well. So, you know, that's been a difficulty, I think, for everybody throughout this crisis. But the stress of this on all of the hospital staff, myself included, has been enormous. You know, I have not had a day off in this current surge in months. I mean, so I'm working every day, all day long, constantly on it. There's always, you know, the next crisis to be solved. You know, that's ultimately not sustainable or healthy. And, you know, like I tell everyone else, take an afternoon, take a break, take a walk. I need to say that more to myself, because, you know, you do need to take care of yourself. You need to keep your perspective, and you need to take care of, you know, your family. So I think it's difficult. And although we try to message that across the hospital, and I think, you know, we've done a lot of great things. We have a room in the hospital where staff can go and just sort of sit and meditate and have a quiet moment. We've, you know, we set up a line to speak to people in our behavioral mental health program to just talk about your stress. And I don't think we've seen all the fallout of this yet. I think, you know, I've seen, you know, some of our, you know, toughest kind of ICU doctors who've seen it all, you know, totally break down in the hall and just, you know, just another death after death after death in the spring, really impacting people. And, you know, I think we're going to be managing that and helping everyone through this, you know, PTSD I think people are going to have from this, you know, for months or years to come. And, you know, and I'm not immune from that either. I mean, there's days that, you know, I'm on my last, literally my last nerve cell, right? So then you're not, it makes it hard to be your best self. So it's been a really tough time. And I think anyone, you know, who doesn't acknowledge that is, you know, in deep denial, because I don't think this hasn't touched anyone in a way that's been incredibly stressful. And you know, and also suffered personal loss if, you know, someone, you know, a friend or neighbor, you know, died from COVID. And, you know, because there were so many deaths in New York, you know, I think everyone knows someone who died from COVID. So it's been personally difficult, professionally difficult. And then you're trying to support your colleagues to the extent you can, but at the same time, placing so many demands on them, you know, that there were days I go home and I'm like, I really feel guilty about this. I'm driving the team so hard. You know, right now we're trying to vaccinate everybody. And it's like, it's another whole huge job that's been put on the backs of the hospitals in a system that's, you know, I'd say, I think fair to characterize at the moment, a little bit chaotic, and not predictable. And, you know, just like driving people to do even more. Here's another whole thing that we got to do and operationalize and get done. And, you know, and no matter what you do, it doesn't make everyone happy because there's so many rules about, you know, the prioritization. So, you know, lots of stress, lots of difficulty, lots of asking people to do things that, you know, are way above and beyond the call of duty. And you know, it's difficult not to be able to offer them, you know, the break they may need from that. And I'm in the same category, you know, I'm not immune from it. It's been tough.
Dr. Galati?
Well, you know, again, with what Dr. McGovern said, everything, this is stress on steroids for everybody. But to take a little bit of a different tack, what I did was we did have a lot of telemedicine that we did with our patients, and I was able to do that from the comfort of my home office upstairs. And then what I would do is in the evening after dinner, when things would settle down around the hospital, I would sort of sneak in, make rounds, and it just was a little bit more quiet. But as far as the self-care goes, my son, who's 27, lives out in San Diego, he came home originally for just a 10-day visit. He ended up staying 8 weeks because he works in Major League Baseball and he was working from home. So he was home. My younger daughter lives at home following college. And so we were all home. And we, late in the afternoon when I would finish up, we had cooking classes. I love to cook. And so got the kids involved in that. For the first time in a long time, we were playing board games. We were exercising together. We had bought a Peloton several months earlier and we were wearing the thing out. We were all having competition on it. So I think with a conscious effort, you have to hit the pause button and say, we're taking time. I need a mental health break, and try to enjoy the people around you, because in situations like this, you could be taken away with the vortex and just, you know, whisked away, and it will make you sick. So you have to, in a sense, have a strategy to combat that. It's not always easy, but you have to have sort of a plan in your head. So that's sort of what we tried to do.
Dr. Inan?
So to echo everyone's comments, stress on stress on stress. That's what this has been. But my focus really has been on my children. And so I married a Titan. And we have 3 kids, 13, 10, and 8. And early on in the pandemic, you know, we, these super motivated folks with these busy lives, now have kids that are staying at home. And not only do you have to handle the logistic challenges of that, but you also have to handle the challenges that come with the fact that kids are social creatures and they need that stimulation. And they're not getting it because they are doing what we're doing right now, right? And so in many respects, in efforts to keep close contact with them, had to leverage technologies like Zoom and FaceTime and all that kind of thing to stay in touch with them, my kids, as well as my family across the nation and across the world. We also got a Peloton. So I was so happy you said that because, you know, taking these kind of social things and leveraging technology to still keep you connected but safe was one of the things that we did a lot. And then I started playing video games with my kids, which is something that I hadn't done in decades. And so bought some stock in Nintendo as well as some Nintendo devices and played a lot of that, which was, you know, more than my kids could appreciate, a release for me. From a stress perspective, but also it helped me stay connected to them and help me make sure that they were mentally okay, which is very, gave me a lot of peace of mind. So.
Thank you. So I just have one more question for you guys. And my question with 2 students sitting behind me, my question would be, what advice would you be willing to share that helped you reach your goals that they can benefit from? Dr. Galati, would you like to start?
Of course. You know, I wrote down some buzzwords here. Again, what others today have said. Number 1, hard work. Do not underestimate how hard it is. Now, hard work does not have to be a total drag, that you're miserable. If you love what you do, and you've all heard this before, if you love what you do, it really isn't work, but it is, you have to commit to it. Never burn bridges. That is the biggest mistake that people make. Burn bridges. You know, again, just a story. My son, when he was in college, I called up a alumni from Holy Trinity. I was great friends with him. We worked on the newspaper together. We played sports together. But I had not seen him since graduation day. I double checked, triple checked, hadn't seen him. I found his number and I called him right in front of my son because of what he did. And I hung up the phone. My son said, it sounds like you see this guy all the time. And I said, I haven't seen him since 1977. But you never burn the bridge so that you, at any time, you could pick up the phone and call somebody. Along those lines, you have to remember where you came from. No matter how much fame or accolades or success that you get, you are who you are, where you came from, and never forget that. Be kind to everybody. Be kind to everybody, because again, you never know when you're going to have to pick up the call and ask for some kind of help. And the last thing really is, for me, you have to get out of your comfort zone. You cannot be scared to try something new. You cannot be afraid to fail. Be daring, be bold, go forward and try new stuff. And again, that deep domain knowledge that you have a lot of things that you know about because you tried different things. That really is the key. That's what I believe in, for sure.
Thank you. Dr. McGovern?
Those were all great comments and really resonate with me. And actually something, Kwame, you referenced is, things will happen along your path that you don't expect or just pop up, sort of serendipitous things. And don't be afraid, to pivot or seize on those things or say, oh, maybe I could have gone this route, and now this opportunity just put itself right in front of me. Seize those opportunities and really be open-minded about where your career is going. And, one example I can give you is, after I finished my fellowship in molecular genetics and, genetic testing then was like new. All right. So I am old. Yes, I'm really old. All right. So it's all brand new. The labs are even figuring out how to write a proper report so the doctor knows what it means. And the CDC was very, very interested in studying this issue and making sure like the quality in these labs was good and the reports would be intelligible to other physicians. And just by serendipity at some meeting, I bumped into someone from the CDC who wanted someone to do this body of work for them. And they were like, well, maybe you would like to do it. And I was like, okay, well, I never thought of doing that, but I did. And I had a series of grants from the CDC over a 9-year period to do this work that became an international project. I got to go and talk about it all over the world. And it was just because I bump into a guy and seize the opportunity. So always do that. I think that advice about never burning a bridge is so important. It's something I tell any trainees that I ever encounter. Never leave somewhere on bad terms. Never give in to like being annoyed with someone and saying, well, I don't need you and I'm going to move on. You never know. You never know where you look. I was an undergraduate student at Stony Brook. And look, I wound up now at this point in my life, I'm back at Stony Brook, right? And I kept relationships there. You never ever burn a bridge. I think that's great advice because you never know where you're going to end up in your future. And really just being flexible about, what path your career takes. And, I don't think it's that much easier today than it was when I did it, but, for your female student there and, for men too, because you talked very nicely, Kwame, about your family and wanting to care for them, being in medicine and trying to have a family and do right by everything. You must be infinitely flexible and you need to sometimes say to yourself, I need to do something a little bit different to get through this period in my personal life, right? So, for 18 months in my career, I worked part-time for 18 months. I had 3 children under the age of 6 years old. And I said, this is crazy. Like, I'm not doing right by my career. I'm not doing right by them. I'm not doing right by my family. I just needed a little bit of a timeout, give myself a break. So be honest, be honest about what you can do and how far you can stretch and are you always being your best self to every dimension of your life that's important to you? So, I think those are things that you need to constantly be reassessing. What are your priorities? But the biggest one, and you referenced it, Joe, is, just follow your passion. If you're doing what you're passionate about and you love, I literally get up every single day and love going to work. I never say, oh, wish I could pull the covers over my head and just stay here. I love my job. I love going. Are there aggravations? Yes. Or are there parts of it that sometimes are tedious? Yes. But, in the totality this is a wonderful career. This is a great way to contribute. And it's so personally satisfying that if you're following your passion, you just can't go wrong, whatever that is.
Dr. Inan?
Well, I'd say that you left the most unqualified person for last. It would have been awesome to have my senior doctors here taking the last word, but I'll take it. I will echo a lot of their sentiments. There's 3 main things that I think are super important to success, period, and especially in medicine. The first one is to always be a student. So even in this short period of time that we spent together, I am taking gems from Joe and Dr. McGovern. I'm taking them and they're going to stay with me. The world's your teacher and you just got to keep your eyes open and your attention peeled, and there's a gem someplace. So take advantage of that. The second bit is delay gratification, right? If you want it now and you get it now, chances are you're not going to take the next step to get to where you want to go. So you have to understand that for a long time and many times repeatedly, you're going to miss out on things that you may want to do. And the gratification comes at the end. And I can tell you that, I finished training in 2014. I haven't been at this for a very long time, but it's been a great time. And it's been very, very gratifying. And so there were some parties I didn't go to at times in my my training and education and things like that. And I delayed that good time for these good times. And so that's particularly important. The last bit I'd say is to be flexible, right? So keep an open mind. Dr. Galati is an incredibly well-respected physician in the GI field. And I can tell you that when I was in your shoes and when I had gotten to college, I wanted to be a GI doctor. I mean, I was doing so much research. If you look at my medical school research, it's all about nutrition and things like that. And my life now is the furthest thing from that. And so if I'd gotten so pigeonholed in my thinking, I may not have the personal satisfaction that I have today. I love what I do. And to Dr. McGovern's point, every morning when I get up, I know that I'm going to make somebody's life better. And that's incredibly fulfilling. But I was able to get to this point because I realized that at every stage of my experience, that next step that I thought was going to be a certain way was actually a little bit different, was actually a little more challenging in this way or that way that I couldn't possibly have foresaw. And so ultimately what I'd say is keep an open mind and work hard. Put yourself in a position where you can take advantage of opportunities so you don't close doors for yourself and don't burn bridges. That's super important.
Thank you. So we have about 10 minutes left. I know we're all kind of short on time here, but I just wanted to give our student moderators an opportunity to ask a question, if that's okay with you guys, if you have enough time. So I wanted to give Neela an opportunity to ask her a question first.
Yes, so Dr. McGovern, I know that you work with Stony Brook. I'm actually applying there, and I was very interested in the BSMD program that they're offering. Do you have any advice for anybody who's applying?
The undergraduate program where you go right into the medical school track, is that the program? Yeah. So, it's very competitive. I'm sure you already know that, right? I'm sure your Titan background will get you a leg up. So, I think that, you need to be checking all the boxes. To get to something actually Dr. Galati said, being well-rounded really does carry a lot of weight these days, with going into medicine. And I think if you're a well-prepared student and, you've got the horsepower in terms of your grades, and you're engaging in other activities, which it sounds like you are, you're on the dance, and I think the figure skating, you're doing other things that you love. That's the kind of students that they look for. And, I can tell you have a lot of presence, you're going to interview very well. Just be yourself, be honest. And, I think you have a great shot at getting into that program. And it's such, the people get into that program do very, very well. They're very successful. They're very well supported. And it's really crafted so that, you can explore other things other than science, which is, a real benefit of it because, you sort of have that relief that you know what your pathway is. And while the expectation is that you're going to be a great student and really produce, there's a lot of flexibility for you to pursue other interests. And, more and more, it's very well recognized in medicine that that's important, that people have other interests, that they bring other things to the table. So, don't be afraid to do that and explore other things.
Thank you, Dr. McGovern. Bryce?
Just the word Dr. McGovern, I am also applying to Stony Brook University, so please remember this space. Dr. Inan, I myself want to, I aspire to be a sports medicine orthopedic surgeon. Are there any tips that you would give for me to be successful in that role?
I think the most important thing, no matter what field in medicine that you do, is to get some experience with someone who is eager to show you the ropes. And the earlier you get that experience, the better. The reason being is that, like I said, my pathway early on was to be a gastroenterologist of some type, and I got that early experience. And I enjoyed that experience. And I realized during that experience that wasn't necessarily where I fit the best. Similarly, if it is where you fit the best, it puts you in a place where you can take advantage of those relationships by potentially getting into research or just getting even hands-on experience and things like that. And the earlier you do that, the better, and that makes you more competitive.
Thank you so much. Well, it looks like that's a wrap. So I want to thank you guys so much for joining us. You know, I think sharing your stories and offering your advice and guidance is going to go a long way, not only with these two students behind me, but the whole Holy Trinity community, which will be able to view this discussion. So, like I said, thank you. Be safe, and go Titans. Once a Titan, always a Titan, right?
That's
Which
See the
right.
colors? See the colors?
Yeah.
Much, everybody. Take
All
care.
right, guys, take
Okay,
care. Thank you.
Thank you now.